So many of you may have put off your regular appointments during the pandemic, but now's the time to make sure you get in, check in on your overall health. I'm with Dr. Annie Moore from CU Medicine Internal Medicine in Cherry Creek. And September is Cholesterol Education Month. So I kind of wanted to talk about preventive health, numbers you should know. But for cholesterol specifically, when should someone have their cholesterol levels checked?
Like so many things, there's not a real black and white answer. It depends on family history. If there's a big family history of heart disease or high cholesterol or cholesterol related problems, then usually you want to start checking your cholesterol as young as 20, or even sometimes in real severe cases earlier than that. If you're one of these people who nobody has heart disease and cancer, probably 30s is good. Get a baseline, see if you need to tune up on sort of lifestyle things that can influence it. But we really make our treatment decisions based on a lot of other factors than just the raw numbers.
You just kind of mentioned it. It can be family history, it can be lifestyle. So who is at risk of high cholesterol? How can we improve it?
Well, everybody is at risk of high cholesterol based on the American lifestyle that doesn't always have the healthiest diet or a more sedentary lifestyle. But there is a big genetic component as well. And particularly there are diseases, hyperlipidemias, they're called, that run in families. That's often something people, unless they're adopted or something, know about. And those people are the ones we want to get in a little bit earlier and understand if they've inherited that risk.
What are some ways you can improve cholesterol? Is it always medication, or are there lifestyle changes that can really help you improve those numbers?
Lifestyle can help improve cholesterol quite a bit. People don't always realize the same diet that prevents diabetes, dementia, and heart disease is all the same diet. Low in simple carbohydrates, low in saturated fats, high in fruits and vegetables, high in whole grains. It's a basic Mediterranean diet, it's often referred to.
What do you recommend for patients as far as exercise or getting active?
So again, what people can do is really influential on how we recommend exercise. For not everybody can get on a bicycle, not everybody can go swimming. I'm a big fan of walking as a baseline. There's a Latin phrase, walking to heal, it means. Walking is such a natural activity, and many people, if they keep at it, can walk their whole life. So I love to get the 10 to 15,000 steps a day in recommended. I think some other things that create flexibility, stretching, strength are really helpful as well. I'm a big fan of swimming, cycling, all the things people love to do here in Colorado. Light weights, I think, are great. I think people have to find what they love and what they'll do.
And doing something obviously better than nothing, and try something and see if it helps your numbers. Speaking of numbers, when someone gets, a blood test and their cholesterol's checked, there's HDL, LDL. What are those? What should our numbers be?
Yeah, some simple ways it's remembered is HDL is the happy and LDL is the lousy. So that's how you can kind of remember good and bad. Good HDL, it's great to have a number that's higher than 50 or 60. That's really associated with prevention, driven with healthy fats, exercise, raise those. The lousy, new goals of trying to keep that under 100 for many people, particularly if there's health risks, other health risks. If you have no other risk factors, we'll often tolerate an LDL in the 120, 130 range. And as you age, that also influences the risk of having high cholesterol goes up as people get older. So we're always taking those factors. Are you diabetic? Do you have high blood pressure? Are you smoking? All those things into account before we make a medication decision and not just lifestyle.
And your background, I don't know if you want to mention, is in integrative medicine as well. How does that change how you might treat a patient that has high cholesterol or needs to lower their cholesterol numbers?
I beat my patients up about lifestyle. I'm always saying, hey, if we can get by without using medication, because all medications have side effects. So, and cholesterol medications are no exception. They have potential for side effects. So I'm so hopeful to try to find what is within them. No one changes unless they decide to change. And so my goal is to try to find what is it in you that would make you want to make healthy lifestyle changes, be a little different, and choose this healthy path.